Awesome. All right. Well, thank you everybody else who's been able to make it. As I'm sure you all know, my name is Christine Lafontaine, and I am the research navigator for the C3. We have two speakers today to talk about active living with cancer, exercise for the CCA community. Our first speaker is Jodi Steele. She's a registered physiotherapist and also an educator and the founder of the Cancer Rehab Inc. Jodi has spent nearly 2 decades designing programs that help people with cancer improve strength, energy, and quality of life. She will share why exercise is important for those living with cancer, how it can help during treatment, including managing side effects such as CIPN, and provide practical tips and examples of safe, effective movement. So thank you, Jodi, and I'll hand it off to you.
Oh, thank you. Thank you so much for having me. And I'm going to apologize that I have a really hard time saying cholangiocarcinoma. It's a very long one. And I know that you can probably appreciate that it is a rare cancer. So over my 25 years of being a physio, I have seen some clients that have that, but by no means am an expert. So I'm just bringing you the latest and the greatest on research and how we practice in my clinics for all people with cancer. And we hope that we can sort of extrapolate some of that research and use it for this particular community. So to start out with, okay, it's not letting me move my slides. Let's do it that way. That was our agenda. Thank you. The first one that I wanted to bring to your attention is, 20 years ago, the infamous they, really had no idea that their exercise was good for people after they had a diagnosis of cancer. And only in the last 10, 15 years have we really got some solid research that shows exercise is key in actual survival, physical activity and survival. So these are the big studies, and you probably won't be too surprised to see that they are on like 3,000 women with breast cancer. The next one is on, 600 people with colorectal cancer, and the last one is, almost 2,700 people with prostate cancer that were followed over time and looked at their amount of physical activity. And it is absolutely fascinating to see in these studies that those who exercised more had greater outcomes in better survival, as well as those who exercise had decreased chances of reoccurrence in these cancers. Now, I don't have a study for C3, unfortunately, for your community, but I think that we are starting to get more research on the rare cancers. They're starting to lead a little bit more about multiple myeloma. Oh, my light just went off, sorry. Doesn't think I'm here. Okay. It's really we're starting to get research about the smaller and more rare cancers. So hopefully someday there will be a research article just specifically about physical activity and bile duct cancer. You're probably wondering is what else did those exercise articles, because now there's tens of thousands of these articles, and what they do look at is how exercise affects certain things. And the one that I find very compelling is the scientists that looking at it, in a petri dish and saying what's going on when we exercise. And what they're starting to see is that exercise really helps to reduce chronic inflammation. And for those who have had cancer or have been through any of the treatments, people are riddled with inflammation, which causes a lot of the pain, a lot of the muscle loss, the sarcopenia, things like that. So it's interesting that we see exercise, and at a molecular level, we are seeing it's a certain type of exercise and it's a certain grade of exercise, like an intensity. And they're really starting to pinpoint when these natural killer cells or these T cells are released during exercise to help reduce inflammation. So I'll talk about that briefly in a second. But other things that we see from the research is that exercise helps reduce some side effects of cancer and its treatments: nausea, vomiting, pain, anxiety, depression, sleep difficulties. And so, I didn't write all of these studies down, but of course, if you're interested in any of them, I'm happy to provide them for you. But I just thought I'd highlight what I felt was the most important for today. One of the big ones I find is prevention of muscle wasting or sarcopenia or loss of muscle tone, because that is directly related to anorexia and then also directly related to survivorship. So we want to make sure people exercise to maintain some lean muscle mass as much as they can. We know that not all cancers in their treatment cause people to lose weight, but some actually cause to gain weight. I can't say I know about your cancer, so you'll have to educate me. But I mean, most people don't know that fat gain is very prevalent in breast cancer. In fact, I can't remember the exact statistic, but a significant amount of women with breast cancer gain like 60 pounds during their treatment. So that in itself is not healthy. So exercise helps to kind of negate that a little bit. The next point here is that we know exercise helps with mood and quality of life in a lot of our chronic illnesses. Exercise also helps to induce changes in the brain that can help with centralization and associated with pain. We also know that exercise can reduce the likelihood of actual cancer reoccurrence, but also developing other chronic diseases. And the one that we're really worried about, physiotherapists and scientists, is heart disease, because the newest kind of research they're talking about rehab we're trying to do is oncocardiac rehab, because we know that a lot of the great medications, the immunotherapies, the chemotherapies, they are cardiotoxic, so bad for the heart. So that might be a whole new line of rehab, just to exercise people to help reduce people that have had cardiotoxicity due to their cancer treatment. So we know that if you exercise during your treatments, we can help to maybe negate some of those problems, as well as diabetes, which some of our medication can cause diabetes. It's like type 2 diabetes. That would be a lot of our corticosteroids. And then as well, we know some of our hormonal treatments and other treatments cause osteoporosis. So we're basically exercising, trying to go against these bad side effects of the medication. Next, this is the little one I wanted to talk about. This is a fantastic study. If you have a chance to only read one, this would be the ticket. Well, I think, especially if you have chemo-induced polyneuropathy. And my understanding when I was looking and working with Corri, I did know that she was on an awful lot of chemotherapies. And the ones that she was on are a lot of the ones that cause polyneuropathy. And those are the platinums, the cysteines, the vincristine, Folfox, a lot of those. So if you're not familiar with what polyneuropathy is, it's a glove-like paresthesia that's either in the hands or the feet. And I say glove-like because it can be the whole hand to the whole foot. If someone has a back injury or a neck injury, their pain and tingling would follow a dermatomal or a nerve pattern. And that would be very different. That means it's probably coming from, their neck or their back, and that's how we would treat their pain. But unfortunately, chemotherapy attacks all the nerves equally and the small capillaries of the hands and feet, which also causes nerve damage. And so people, not myself, but people with polyneuropathy it's more glove-like. So people tell me, Jodi, all my fingers go numb, or I'm having trouble grasping because I can't feel the tips of my fingers. Or one lady said, I feel like I'm walking on gumballs. I'm like, oh my God, this must be horrible. Like she could, so there's lots of different descriptions on how the sensations have changed in the hands. In the actual research, as you can see from this slide, it actually, these are what they identified when they tested the people. And again, it was numbness, tingling in the hands and feet, hot and cold sensation, feeling of cramping or difficulty handling small objects. What I found was interesting was the next one. And I see this at my clinic, gait and balance problems, which is really scary if people are at risk of falls. So we need to fix this polyneuropathy because we don't want people falling and ending up in hospital. The other one, also very interesting, point 4 there, is orthostatic hypotension. So there is some association with polyneuropathy and having that really bad dizziness feeling when you go from lying to sitting or sitting to standing. That's orthostatic hypotension. And the problem with that is, some people get that. It's most common in the elderly, and secondly, in clients that are on multiple medications, which again would be your crowd, unfortunately. And the problem is when you go from lying to sitting and then sitting to standing, it doesn't happen right away. There's a little time lapse, about 3 minutes between the change of position. So people sometimes get up and they feel fine, and then they go to the bathroom and they pass out because their blood pressure drops. That's scary, orthostatic hypotension. And so we think that we can help treat it when we treat the polyneuropathy. And then the last couple, you can see, of course, if your fingers are numb and you can't do your activities of daily living, it always reduces your quality of life. So this research paper talked a lot about how we can exercise at certain parameters and certain things, which I'm going to share with you in just a second, and how we can reduce that polyneuropathy sooner. I'm not going to promise that we'll get rid of it. I'm not going to promise that it'll go away while you're on your chemos and while you're on all these different drugs, but we do see a pattern of people getting better faster when they perform these exercises. So that's something you suffer with. I figure you got to weigh the bad and the good, right? It won't hurt you to exercise, so you might as well give it a go. Just make sure you're under the, you know that it's not going to be you exercise one day and magically it's going to go away. It's a bit of a process, as I'm sure you know. So let's talk about the prescription of exercise. The research presently says 90 minutes of exercise a week. So 90 minutes is in then a week, not a day. I said the day in another presentation, everybody gasped, not a day, that would be terrible, in a week. And we used to think it had to be in several larger bouts of, bigger chunks like 30 or 40 minutes at a time. But we now know from newer research that it can be any combination. Even if you got 10 minutes a day or 12 minutes a day, it's still seeing good results. The key is the intensity. So this looks very confusing. It's 50 to 70 heart rate reserve, 60 to 80 max heart rate. If you've ever been to one of Wellspring, my clinics or my program there, we all work at 60 to 80% of max heart rate. And it's great. I'm going to show you how to do that in just a sec. If you have a watch, then you get to cheat. You don't have to even work hard. But if you want to do it the old school way, it's about taking your pulse. The key is to find out what your zone is first, and then you want to work. There is no research that shows working below the zone there's any of these wonderful things effects that I'm telling you about. And we haven't got any research that shows if you work above the zone. So you basically find the sweet spot, you find the zone, and then we suggest that you work in it. And so if you need help, physiotherapists or personal trainers or any special people that are, that especially work with cancer would be able to figure this out for you and get you on your way. But you can do it yourself because we're going to do it in 1 second. I just wanted to make a comment again on the timing. Again, you can be your 90 minutes can be any combination you like over 7 days and when you come to our clinic at Wellspring, it's 2 times a week. So you come for 45 minutes to an hour each Tuesday and Thursday. So we do it in 2 big chunks, but it absolutely doesn't have to be done that way. And the last one is the type, and that is that it does have to be a combination of aerobic exercise and strength training. So first of all, let's try, who likes math? Nobody. This is, Christine, good, she can do it. Good. So we'll send you over to her. So if you're struggling, this is the formula. 208 minus 0.7 times your age. Now, I know the young people all know, what's this, bedness or deadness or bedness? We never learned that. We're like, just do it right. But my understanding is bedness is brackets first. So if you were going to do it on paper or in your calculator, you probably can't see that, but you would need to do, so it'll be 208 minus, you can't see, sorry, I should get a scribble board here, minus bracket 0.7 times, and say I'm 50, so 50, end of bracket. That would give me, you can't see, but there it is. Mine's 173. That's my max heart rate. Then I need to find my upper and lower limits. So I would take my max heart rate and times it by 0.6. So my lower limit would be 98. Well, this person is, this is a 65-year-old person. I'm doing myself and the person, but let's do the one on the board. It's easier. Anyway, so this person is going to be, their lower limit is 98 and their upper limit is 130. So it's a fairly big range. So if you are on chemo and you don't feel well, or you just had surgery, then you're going to work in the lower range. However, your heart might not think that because chemo and immunotherapy sometimes rise the heart rate. So the other thing is your heart rate's going to be higher and you're going to be doing less than what you normally did. So maybe you were used to going on the treadmill in or 5 or 6 miles an hour, whatever. And now it only takes a mile an hour, a kilometer an hour to reach that zone. And that's what you just have to be aware of. You the zone in a safe way, but it depends on where you are. As you get more and more healthy, then you have to work harder to get into the zone because you're more healthy, right? So now when you're recovering, then you're going to have to go on the elliptical, maybe go on a bike in order to push yourself a little bit to get into the zone to still get those great effects. Does that make sense? I hope so. You're going to repeat. And Christine offered to everybody to call her to help with the math. And we're certainly happy to help you. If you are on medication that blocks your heart rate so that you wouldn't have a normal rhythm for some reason, beta blockers, I'm not going to list them all. You would talk to your doctor or your pharmacist. The other way we can do this is also through rate of perceived exertion. So these are scales hanging up in my clinics that you would pick, on 0 to 10, how hard are you working? And we want people to work in the moderate intensity. So, if you use the first scale, that's the newest scale. The young people love 0 to 10. I love the other scale, 6 to 20, because that's the real Borg. That's the one I did research on. And so you have to just you would have to rely on your feelings of how you felt and pick a number. And then we want you to stay, between 3 and 5. And if you felt like you were a 2, we would push you harder. If we felt like you were a 9, we'd pull you back. Same goes for the Borg scale, the 6 to 20. We would try to keep you in that moderate intensity. And these rate of preservation scales have been tested on clients with cancer. They've been tested on cardiac. They are very reliable. It just takes a little bit to get used to them. And I always say to the clients, don't overthink it, because it's not about overthinking. It's pick a number that describes. We even have them translated in different languages if that's something that helps you to understand, the adjective that we're using. Okay, so then you have all that. We know that the intervention has got to be something between 60 and 80% of your max heart rate. We can also, if you're just a walker, you could try finding your heart rate and then progressing. The research recommends just progressing your total numbers of steps by 5 to 20% each week, as long as you're in the heart rate. So that's the key. You either got to get yourself a watch, or you got to we don't recommend on the neck anymore, but take your heart rate, and then you can start to progress as you become more fit. If you come to Wellspring or one of our clinics, we do interval training, because I find people are pretty unwell when we get them and they can't do a 20-minute walk. So what we do is, if you can see in the aerobics, we're going to do 5 bouts of 3 minutes. So you're going to go for a 3-minute walk. Then you're going to do an exercise. So whatever you know at this point, unless you want to come see me and I'll give you lots, bicep curl. Does that blow anybody's mind if I said bicep curl? You might do 2 sets of 10. Then you bounce back over here, 3-minute, go for a walk again. Or if you have a bike at home or a treadmill, then you bounce back. Maybe you do a little mini squat. So you pick the exercises. And if you come and see a professional like myself, I would pick the exercises based on what I feel your weaknesses are. But I find the clients they know what they're weak in. And we bounce back and forth. Cardio, strength training, cardio, strength training. By the first day, it takes about 35 minutes. They check to make sure that they're in their heart rate, or the person or you would check. As long as you're in the heart rate, you get to check the box for 35 minutes of in the zone for that week. And you'll see clients at our clinic, it gets harder as we work through. So by day 5, you're doing 20 minutes of cardio because you're doing 4 bouts of 5 minutes. By day 8, you're doing 6 exercises. So you might decide, oh, I really like seated row. I remember back in the day, I used to do crunches or whatever it is. And we start adding exercises and increasing your cardio and everything. And so by the end of coming to see me for 3 months, you would be doing 30 minutes of cardio and 6 exercises, and you would be getting 120 minutes a week if you stayed in the zone. The problem at our clinic is people like to talk a little bit, but I love that too, because it's good community. But you don't get to count those if your heart rate drops out of the zone. I'm just joking. I sound terrible, but kind of true. Anyway, this is your other logbook, how you would record and decide day 1 matches day 1 on the other logbook. And if you're wondering recommendations, basically, I'm running out of time. I'm sorry. My big recommendations is make sure that you have a safe environment. If you're on a lot of chemo, your immune system might be down. Perhaps a home program might be a better idea. Focus on your balance. The worst thing that can happen is fall. So I've actually put in some pictures. We want you to have good balance before you start doing any crazy biking outside or running or whatever it is you like to do. Balance is key. Protect yourselves from falls. I already said I sound like a broken record. Keep hydrated. Move slowly and smoothly. There's no rush. And focus on your form, because again, if you hurt yourself, then you'll be back to square one and you don't get to exercise at all. So we are really adamant about having good form so that you can get through your exercise program. So if you're interested, this is just a page with some suggestions. If you like words, you can Google these. Don't do anything crazy like Arnold Schwarzenegger. Love him, but just keep it to simple Googles and pictures of squat, side bend. They're just some ideas. And the one that I thought I would put in is just some suggestions for balance, because literally tonight you could try to do a little bit of balance. So this would be either pretending that you're standing on one leg by your kitchen sink and holding on. And we used to back in the day think that you only had to balance for like 30 seconds to make real improvements. But with polyneuropathy, that tingling in the hands and feet, they want you practicing 1 to 3 minutes per limb per day. So even if you could stand on one leg, if that's too hard, start low, start at a minute or 30 seconds, work your way up. If that's too hard, you could do what's called tandem walking. And that's like pretending that you're walking on a tightrope, heel to toe. Do that for 1 to 2 minutes or 1 or 3 minutes a day. And if you're not sure what that looks like, here's my good friend Paul at Wellspring showing a single leg stance. He's showing it on the floor. He's showing 2-footed stance on like a little Bosu ball, which is kind of challenging his balance. And then he is on a wobble board. So there's lots of ways, but really close to a wall, really safe, not going to fall, but challenging his balance daily. And then if you wanted some exercise, these are resistance exercises. So here we have, machines if you have opportunity for that. If you're just doing something at home, you might be doing toe raises, holding onto a chair. You might be doing some abs by yourself. This lady's just hooked her resistor band up to the door frame and she's sitting on a ball and she's doing seated row. So lots of things you can do for resistance training. Cardio is a little bit harder. We offer a lot of machines at gyms and at different clinics, but you can always just walk. You can always walk inside your house or outside your house. So hopefully that's helpful. Went 2 minutes over time. I'm sorry, Corri. Let's get to you, but I can stay at the end for any questions. Uh-oh, how do I unshare, Corri? Unshare. Get Corri's up here. Just give me 1 sec, Corri.
Thank you so much, Jodi. Now I'm going to introduce Corri, if you haven't met her yet. Corri Desaulniers was diagnosed with cholangiocarcinoma in 2022 and has since become a dedicated advocate for patient support and awareness. As a participant in Wellspring's cancer exercise program, she has experienced the benefits of movement firsthand. Corri is going to share her personal journey with exercise during cancer, the challenges she's faced, and how staying active has given her both strength and resilience. Corri?
Hey, everybody. So disclaimer, this is my very first webinar and I have had a phobia of public speaking for a very long time. So this is, again, stepping outside of my comfort zone, but as part of my advocacy journey, stepping out of my comfort zone is my new normal. So I thought first I would share just a quick overview. The slide that you see in front of you is much more detailed than I'll just give you the quick highlights. So yes, I was diagnosed in 2022 early. By May of 2022, I had a successful liver resection and then started adjuvant therapy. I did that for about 6 months and then had 2 follow-up scans, which showed that the cancer, while there was no recurrence in my liver, I had a pretty big recurrence in my peritoneum. So at that point in April 2023, I started Gemcis-Derv. And from April 2023 through till August of 2024, it was Gemcis-Derv, just Derv, FOLFOX, and we sometimes achieved stability. We sometimes had progression. But in August of 2024, I had probably one of the worst days of my life. Basically, I was told there was no hope left. And that is when my good friend Cynthia nudged me towards my other now good friend Christine, and we pushed for molecular testing on my metastases. Because of that, we found that I have an FGFR2 mutation. We found we did all of the jumped through all the hoops and the red tape, and December of 2024, I was able to start pemigatinib. And pemigatinib I'm waiting for my third scan October 9th, so next week. But my first two scans have been positive. My tumors are shrinking, so I am a PEMI success story. However, we can go next slide. Or can I take over? The pemigatinib does have a lot of symptoms. I don't have the neuropathy that Jodi was discussing. I did have a lot of that with my previous treatments, but I am exhausted. I have zero appetite. I am down about 40 pounds and steadily losing weight. So this is where cancer exercise comes in. And why I chose a cancer exercise program. I was not active at all. And I wanted to start. As part of the advocacy, I became an ambassador and part of the planning team of our cholangio cycle. So I felt like I wanted to bike. And I hadn't been on a bike in well over 2 decades. So, being a member of Wellspring, I met with Jodi. Jodi did an assessment and was very willing to customize my program to suit my needs, being all of my cardio is done on the exercise bike. My strength training is done to either build strength to help me on the bike or to deal with a shoulder issue that I'm having. So it's fully custom-made, fully tailored to my needs. And then I like the fact that there are multiple professionals in the rooms with me. So I don't have to worry that, I'm doing something wrong, I'm going to hurt myself. I can ask questions, people will stop and say, you need to fix this. They'll ask me how I'm doing. There'll be random song quizzes throughout the morning. And the idea that it's just simple and manageable, I don't have to think about it, I just show up. Jodi has already done all of the hard math for me, or one of her staff has. And everything is laid out. I just go, do what I'm told, and I feel great when I'm done. Did the slide increase or advance?
Did that change? Oh, it says
Okay.
cancer exercise, my experience.
Okay. So my experience has been very positive. And I talked to other people at Wellspring, and they have had positive experiences where one of my friends in the advanced cancer support group I attend at Wellspring just completed a off-grid hike. And that was something that she wouldn't have been able to do. She had a lot of bone loss and muscle loss from her cancer treatments. And she's been steady with her cancer exercise program, and she was doing it was multi-day. Do you know how many days it was, Jodi?
Yeah, no, I don't. Sorry, I don't.
No, okay. I'll have to. I haven't seen her since she got back, but it was definitely like a 10 or 11-day hike that she did off grid by herself. Giant backpack that was probably taller than her. Well, from like waist up, taller than her. And I mean, I've had experiences not to that extent, but my husband and I like to travel, and most recently trips end up with me in tears and my husband frustrated because we like to explore and I don't have the stamina to explore. So I feel like I'm letting him down and I get guilt feelings and I put that on him and he gets frustrated and I end up in tears. We went to Montreal this month and I went everywhere. We didn't, do it to the level we used to pre-cancer. We stopped when I needed to stop, but we went all over all over Old Montreal, all up and down Rue St. Catherine. I rode a bike in the middle of Rue St. Catherine because they have this whole new little activity area. So I was proud of myself, and my husband and I had a really good trip. Mood-wise, absolutely. Part of it is me finding new purpose in my advocacy and mentorship journey, but the exercise definitely helps. On the days that I'm not, I notice a difference. If I'm not able to get out for a little walk or go visit Jodi and her team at Wellspring, it definitely makes a difference. I had an appointment with my psychiatrist last week, and he had to pick his jaw up off the floor. He said it is a complete 180 from where I had been even a month ago. I am a new person. Appetite-wise, I am on the right track to keeping my weight steady now instead of losing weight. And finally, it gives me hope. While we don't have exact research for cholangiocarcinoma, there are so many studies out there that show that cancer exercise does give you benefits and reduces the risk of recurrence. That's got to give you hope. So I truly feel like exercise is an important tool as part of my treatment plan. So can we advance one more?
Yeah, done. You can find cancer programs. That's the next
Yes. So I know I'm talking a lot about Wellspring, and I'm not here to sell Wellspring, although I can definitely recommend them. You should do your own research and find what works for you. Wellspring works for me because it is in my community. Wellspring does have online programs for those that don't live in Ontario, or I think they do have on-site locations in Alberta. But if you visit the resource center in your oncology center or talk to the supportive services team or your oncologist who you should be speaking to before beginning an exercise program, or your nursing team, your chemotherapy nurses, they're a wealth of information. The Canadian Cancer Society has a searchable list of local resources available. You just put in your postal code and it'll pop up anything, not just exercise, anything local to you. Your provincial cancer agency, and I've listed most of them on the side. Most of them, when I was searching through them, either have a list of programs that are available or even sheets of recommendations for what you can do, what you might want to do. And not a lot, but some universities have research programs. So they want you to come exercise for their education. And a lot of pretty much anything I'm talking about is free to you. YMCAs have some of them, not all of them, have exercise programs. So you can find it out there. So I don't know what else to say. I think I've kind of set it off. I'm talking specifically about cancer exercise program because that's what works for me. Obviously, if you're a well-seasoned, athlete, you just keep doing what you're doing. But for somebody who is pretty fairly sedentary, this is really working for me.
Thank you so much, Corri. That was really inspiring. So we have time now to kind of open up the floor and have a bit of a discussion or answer some questions. I'd like to start just by asking Jodi, bouncing right off of what Corri just said about, like if you were previously very, very, very active before the diagnosis. One question there for me would be, partially this is mental of like, but you might not be at the same level that you once were. And like, do you find that a lot of people coming from there have a hard time with their new normal? And what can you do to kind of help people in that regard?
Absolutely. Absolutely. There are people that are, like Corri said, that were athletes before and that were very, big yoga people or big. We just base the program. We still, we find their heart rate. It's usually changed because of chemo and because they've become less fit. So we still work them in the exact same heart rate zone, but we might find more challenging exercises. Like they might do advanced lunges, or they might do exercises that the majority of people at Wellspring wouldn't be doing, but we're happy to add some fancy equipment if that's what they want to do, for sure.
And then kind of on the other spectrum, like with Corri, but also just when people like when they say like when they're actively on like chemo treatment and they're so tired, I really like the whole premise of the resting heart rate, because I think the more active you are, the lower your resting heart rate is. Is that correct?
Correct. Good one.
And so if it's, so if you are, I guess, more sedentary or just really tired, your resting heart rate's going to be higher. And so does that mean, like, I think what I'm trying to say is, I guess people who haven't been moving or are just so tired, they're like, I just don't have any energy. What can, like, they they find out their resting heart rate and everything. Like, for them, what does it look like to get to that 60 to 80? Like, what would they be doing?
Sometimes just walking around the house. We have clients that come in, Corri can tell you, that have their walker or their cane or their Nordic poles, and they just walk around the gym, walk around pine cones? No, pylons. They literally are just walking, or they're on a bike that's no resistance whatsoever, spin. Or we have an arm bike if the legs are really not working well, or we're nervous for any reason for using the legs. We do have an arm bike.
And that gives the same advantages as someone who is, a former Olympian who's doing their crazy lunges.
Absolutely. Absolutely. We even have people on oxygen. The only thing I would do if you have a difficult respiratory, I would probably work your intervals down a little bit lower. So instead of doing the 3 minutes on day one, you might be doing a minute. But again, I would have to meet you, and I would have to know why you're on oxygen, but I wouldn't say don't exercise. I would just maybe modify that slightly if you got short of breath.
Oh, perfect.
It truly is customized for every single person that walks in.
And Corri,
it's free too. Did you know Wellspring is free to everybody? It's not covered by the government, but only by private donations. And we have 6 facilities, one in Niagara, but we also have in Toronto. I mean, you can go on the Wellspring, but don't let price. There's no fee whatsoever. And we do have online. So if you're in the middle, we have people way up north at Dawson City and Tweed and Montreal and places like that. Not that Montreal, but it's the other way. We don't have any live. We can also give you a 12-week program online, and you meet, and I would be live, or one of my staff would be live, and we bark orders at you. No, we're nice, aren't we, Corri? We do bark them.
Well, I know for myself, I do much better when I've got, like Corri said, like you walk in and somebody is just saying, like, I've already got everything planned for you. All you have to do is follow the recipe, right?
And you don't have to have cancer to do that. Everybody's like that. The hardest part is getting there, because everybody's like, I don't want to exercise. I don't want to exercise. This is what I've been doing. My whole career is based on that. But if you have the motivation, be it come to Wellspring, meet some friends, whatever it is, that's the hardest part. Then we got the rest planned for you.
Going back to the neuropathy, my very uneducated understanding is once the neuropathy starts forming, it doesn't really go away. Is that true, or?
It will continue while you keep getting doses of chemotherapy, especially those kinds that I mentioned, like cisplatin and vincristine and FOLFOX. It will be pretty intense, and it is dose dependent, so it will get worse as you get more chemo. But once you stop, there is a flush period, and some people luck out. It starts to minimize within a couple months. Some people, it's agonizing for years, but they see with the combination of balance exercises and being a bit more active, we are reducing that time of suffering down. But I'm not going to say it doesn't happen overnight. It takes some time for sure.
Okay.
But it can go away. Lots of people are completely back to normal.
Oh, wow.
I can't say for your cancer, though. I don't actually know. But I can say for breast and for colon and whatnot, definitely can.
But that's after you finished on the course of the chemo. Yeah.
Correct.
At least we know that, like, that is something.
Yeah.
you end up kind of going on to a targeted therapy like Corri was able to.
Right.
Well, from a personal perspective, I never really had anything particularly bad in my hands, but my feet were extremely fuzzy. Um, and my last round of full fox was early August, so like just over a year ago. My feet are still mildly fuzzy, but nowhere near what they were.
That's good.
That's
Mhm.
awesome.
Yeah.
That's perfect. Yeah. Full fox is a bad one
So
too.
time and possibly exercise programs,
And
there
Corri,
is hope.
so Corri, you know, you said you were quite sedentary, and so was it very intimidating to reach out and to physically go in?
Yeah,
Or
I had the little nudge because I was doing the fundraiser.
yeah.
So that's what kind of tipped me over the edge. And also it just I needed to do something. I was not in a good place. I was what I like to say, what I like to call turtling, where I just basically closed myself off. So I was not mentally in a good place and I knew something needed to change. So and
And
even on those days where I am completely exhausted, I mean, I missed last week because I don't know if you could tell I'm getting over something, but sorry. Um, the days that I'm completely exhausted, I'm on, the last couple of days of my pemigatinib and my energy is at its lowest. I've gone in and you know what? Afterwards, I feel pretty darn good.
mm. And then how much, like, when you first started this, you obviously went to your doctors and kind of said like, oh, I'm going to start moving some more. Like, what was their reaction, and how did they have any counseling that they wanted to add to kind of saying like what your limits were, or was being able to consult with Jodi enough to have that framework to know that you were doing it safely?
I think safe exercise is all that my oncologist was worried about.
Mhm.
And physios are direct access, so you don't need a doctor referral to come see a physio. It is direct access. And soon we will be able to actually order scans. That's actually coming down the pipes now. So CTs,
That's
and
really
it's not
exciting.
quite there yet, but X-rays, CTs, and things like that, which might also be helpful in this population of people, so they won't have to wait to get into their oncologist. So stay tuned; it's very close. But yes, you don't need a doctor referral to see us. It's direct access.
And then you would be considered, like, if you're saying like talk to your healthcare professional whether or not this is safe for you,
That would be
then
me.
yeah.
Yeah.
Okay.
Yeah, absolutely. And that's in my scope of practice. For sure.
And then other than Wellspring, I know you listed, we'll be able to put that on our website. So thank you for collating that, Corri. But other than Wellspring, are there any, do you know of any other places like in other areas of Canada that also provides this? Because yeah, I do know that there are a couple of different university exercise programs to better understand specifically cancer and exercise. But are there any other places like Wellspring that you know of?
Not really. The closest Brock is trying to do BFit, which is a similar idea, except it's you're more on a circuit, but you still are receiving 2 times a week exercise. Calgary is quite good. If anyone's
Yes.
from Calgary, we have some fantastic doctors and physios, and Carrie Cornea, who is the research guru. He's amazing. I quote him all the time. They're all there. So there's lots in Calgary. If you're in Calgary, get your fingers going. I can't say for sure, but I'm happy to find that. BC has a lot of stuff for breast cancer. Not sure if it's all cancers. But then after that, I can't say there's a lot specifically. Some wise, just like they have a cardiac program and an ortho program. Some have a cancer program, but I can't speak to that too much. Sorry. We're not there yet. We got to get going in Canada.
I'll look it up, Christine, and email you or WhatsApp or whatever. But there was something out there. It's an initiative to get cancer exercise programs to the remote locations. So I'll get that to you.
Yeah, Calgary is doing a study right now called Excel. I've had a lot of work with Excel, but it's all by Zoom, of course.
Oh,
right?
that's
Yeah,
is
Excel.
program.
I know lots about it. Yeah, if you want me to speak to that later, or I can send you some information, but you can get in there free as part of a study. You just have to live in an outlying area. It's great. It's really fun.
And that's in Alberta still, right?
They're from Alberta, but I was one of the trainers that helped with it too. So I can be anywhere
Okay.
because it's all remote. It's all by Zoom. So it doesn't matter where you live. We do everything by Zoom. Yeah.
Amazing. And then one other question is, like if you do have, like if you're in active treatment, or if you do have kind of like drains or issues post-op, like obviously you can, like you are trained to take that into account, but what are the types of accommodations that happen for that?
We have lots of people on drains. We have lots of people post-op. The biggest thing is if you're on chemo and stuff, we don't want you to get an infection. So that's why Corri was saying she wasn't feeling well. The one thing is we just don't want any infections. So that's our only kind of big no-no if you're not feeling well, or because we could have someone with drains and open wounds in there. So if you're not feeling well, stay home. But again, you can hook onto some of our online stuff. But if you have lymphedema, we treat lymphedema. That's from lymph node resection. Like if you have swelling or discomfort, we treat that with bandaging, massage, and exercise. We are all trained physios. So if you have aches and pains or orthopedic things that are hurting you, we try to treat that as well if you're live with us. And yeah, no, I've never been worried about drains, and I worked in ICU and acute cancer. So we, catheters, drains, all that doesn't really bother us. We would just make sure they're safe to exercise with. Yeah, but PICC lines, a lot of people have PICC lines.
Yeah.
Hickman's, ports, none of that's worrisome for us. Nope.
Excellent. Are there any questions from the crowd?
And if you think of anything or want anything, you can pass my email on, my Gmail account for sure. I'd be happy to talk to anyone personally if they would like. So feel free, just tell me who you are and where you came from, and I would be happy to answer any of those questions.
Well, thank you, Jodi. Janet, do you have a question?
Yeah, hi. I'm on the Quebec-Ontario border, literally. And so I think you said the closest one in Ontario is in Toronto. Okay, I'm going to be there next week. Where in Toronto are you located?
There is one if you Google it, there's one downtown, there's one at Women's College Hospital, and there's one at Sunnybrook. So
Well,
three locations.
Okay, I have to go to the Princess Margaret. So are you near there?
So which one's closest? I would have to look up which one's closest to Princess Margaret. I think the downtown location might be, but anyway, you might get, yes, Google it about Wellspring in Toronto and see which one is closest, or you could call and they would be happy to help you over the phone as well.
So it's WELL Spring SPRING.
Okay. .ca.
Okay.
.ca.
Okay.
And then they all have they're all houses, so they have fancy names by the donors, but they're just houses located in different parts of the area. Like 3 in Toronto, 1 in Oakville, 1 in Brampton, Niagara, Calgary, Calgary.
Yeah. Okay.
We're getting one in New Brunswick where I'm just helping them get organized, but they're not yet. But that's probably not any closer, is it?
No.
No.
I mean, I'm really dry. They say you
wrong border.
Yeah. They
Yeah.
say you would only be 10 kilometers away from the gym that you join because you just won't go if you drive beyond that. So for sure.
No,
But
I find it too, like Corri, I do a fair bit of exercise since the very beginning. Since I found out in 2023, I try to do a brisk walk every 3 to 5 kilometers every day, most days. And I do yoga about half an hour before bedtime. All these things I find, I don't know, I feel pretty good, but yet they tell me how sick I am. But so I find appetite wise is really good. When I was on the first line, cisplatin, gemcitabine, and the immunotherapy, I only had to have 3+ cycles. But as I continued to get more, I could feel my appetite wasn't so bad. It was just the taste of things, and that kind of was kind of crummy. But now I'm on a target therapy, not the same one as Corri, and it doesn't really. Hopefully it's working. I only started it in July, and I'm going to have CTs done next week when I'm in Toronto, and I can't really say. Sometimes maybe I don't have quite the same energy, but I still like Corri said, sometimes, maybe you don't feel so hot, but I never regretted going for my walks because I always feel better, or I won't feel any worse, so I think that's great. And it's always good to change your mind and that kind of thing. And and my diet, I keep to a certain diet, yeah, I haven't really lost weight, or I lose a bit, I gain a bit, but I always stay within 5 pounds. So I think that, but everybody's different, and that's how it is for me.
So now,
Okay.
Jenny, you just got to get a watch and then do the formula and see if you're exercising in the
Yeah.
zone. That would be what I'd be
Yeah.
curious about, because that could be your next goal. Try to get in the zone. Try to get in the zone.
Yeah.
So if you have any
exactly.
trouble, just email me.
I will
Janet.
look into it. Yes. Yeah. Yeah.
There is a Wellspring Hospital Community Hub at Princess Margaret.
Oh yeah.
It says
Okay.
Health and Wellness Cancer Survivorship Center, Floor 1, Toronto Gen, 585 University.
Okay, great. Well, maybe I'll stop by there and check it out.
Mm-hmm.
I'll have time.
It's worth a look. I have
Oh,
lots
yeah.
of programming, and I found it
Well,
very beneficial for me.
Yeah, and I'll probably, maybe if I'm interested, I'll do the online program.
Mhm.
So
Yeah. Kim?
Yeah, I really appreciate this. Sorry, a bit emotional. I've been diagnosed for 6 months, so all new. And just the different feelings are tough. So the exercise has been hard. But I appreciate you coming out.
Thanks, Kim. Where are you?
In London.
In London?
Ontario. Yeah. So there's a
Mhm.
Wellsprings, which I haven't gone to yet, down at the Central Y, which is downtown.
Mm-hmm.
When
But-
you're ready, when you're ready, or if you want to stay online, if it's online is your you know what I like about online? I can wear my pajamas and then I just jump in and do my exercise. I don't have to wear any makeup. It doesn't matter if I got anything going on. I don't have to brush my teeth. Do my 45 minutes and then I have the rest of my day. So if that works better for you, just do the online ones and you still get
people are
community.
important. I like people.
Yeah, agreed.
Right.
Agreed.
So,
Mhm.
and I'm not very good at exercise, so getting out would be very beneficial, right? And being able to make that. I think, like you were saying about the medication right now, I'm in the midst of all of it, and it's just the fogginess for 2 or 3 days that I have that it's really hard to get through.
Yeah.
So.
Well, I would recommend checking out Wellspring in London, even if you start online until
Yeah.
you're comfortable. They have just so many programs that I have found helped me.
All right, appreciate that. Yeah. Thank you.
And Kim, it's been 6 months for you. It's been almost 2 years for me. So you're adjusting,
Yeah.
and give yourself that chance to adjust. Yeah.
Thanks. Yeah.
Thanks so much for sharing, Kim. I have one last question for Jodi, and that's, the idea of the resistance or strength training and the cardio. And do you have to kind of do them at the same time, like that hitting back and forth, or can you kind of go for a walk and then, like later that day or the next day, do your resistance training? And then, also the resistance training, like sometimes I think like, oh, resistance training is like just weights and stuff, but resistance training can be just body, like just with your own body, right?
Correct. The big thing that seems to be the one thing that's really working in the literature is that you have to be in the heart rate. So it's really hard to maintain that heart rate by doing strength training. Now, squats and lunges, sure, your heart rate's going to jump up. But if you're just sitting here doing bicep curl, it's unlikely that you'll reach the zone. So at times it works to do a little combo. Like if you want to go for a walk, you would get a band, a resistant band or a band, put it in your pocket, walk around and then stop and do your bicep curl. That would also work too. Or like you said, if you can walk, you could do the cardio here and then your strength training would be another separate exercise, but those minutes couldn't count for your 90 if you didn't get in the zone. Does that make
So
sense?
it's all about being in the zone.
All about being in the zone, but the research does say you want to do a combination of the two. That's why we switched everything to interval training, because then we sort of check both of those boxes. But yeah.
So both types of training, so cardio and resistance, always in the zone. You always have to be in the zone.
She's got it. Sign her up. Do you want
Okay.
to work for us?
All right. Yes. All right. Well, if there is nobody else who has any other questions, we'll just anybody else?
Yeah.
All right.
Can you hear me?
Yeah. Hi, Leonard.
Hey, hi everyone. Jodi, thank you so much for coming and speaking, and also Corri did a great first job for your first webinar, hopefully first of many. I do have a question for Jodi, and it's just about, like, in your program and training sessions, are caregivers or partners or significant others also allowed to join and maybe see how it's done, and that way they can help do those exercises at home or things like that?
That is a very good question. Wellspring has 50 programs, from Tai Chi to Reiki to everything. Exercise is bigger than all 49 put together. So exercise is the only one that caregivers can't join because we are so overbooked, and it's unfortunate, but like if you wanted to do yoga or drumming or crafts or something, the spouse or the partner or the caregiver, sorry, can join. Exercise is the only one. So we're trying to remedy. I do a fun exercise live class once a month that the caregiver can come, but it's just once a month, just to sort of get them excited, and their partner can or their caregiver can come in, or their client with cancer can just sort of show off. But yeah, as of right now, we haven't figured a way to get everybody. We don't have enough space.
That
Now, I
is
do
a
know.
good question, though.
Yeah, it's a
Like,
really
is
good
there a way to not bring them into the class, but even send home or allow them to observe? So I think Leonard was asking about, so they could help the patient do
That's a
stuff
great
at home.
idea. Great idea. Now, in the Zooms, you can situate the camera that I couldn't see your caregiver and I would not say a word. But when it's live, I'm legally responsible for that person if I allow them into my gym. So I would have to assess each of them and follow them along with reassessments. So it's just a little bit too pricey, unfortunately, because it would be double the amount of people. But I like your idea. I would be happy to send home any kind of pamphlets and stuff, but it's just not the same than really seeing it. I know we need to put our heads together and figure out how we can remedy that. I don't know. Good question though, Leonard. Sorry, I don't know.
All right. Well, thank you, Jodi, and thank you, Corri, so
Thanks
much
for having me.
taking the
Thank
time.
you.
And we will be posting this on our website and stuff, so other people can like learn all the lovely things that we learned today.
Thank you. Take
Thank
care, everybody.
you.
Email me if
Thank
you need
you.
me.
Thank you.
Bye.
Bye.